Hi, this is Dr. Jerry Goldhaber, the Warnings Doctor, and author of the new book, Murder, Inc. Today I want to talk to you about testing. When I was a college professor, my students would cringe when I said that word. But in the age of COVID, testing, as Nancy Pelosi likes to say, that's the key for us to not fly blind, but to know exactly where the virus is and where it has been. But to do this, there are two types of tests. And I want to tell you what each one does and what they don't do, and what are their limitations. The first test is a blood test called the antibody test. That test is when you go into your doctor or he sends you to a lab, they will take your blood and determine if your blood has any of the antibodies that come from COVID, which if it does and you're positive, that means that you were at one point before that test exposed to the antibodies of COVID. Does it mean you're immune? Well, we used to think so, but we're not so sure now. And if you are, we're not so sure how long that immunity will last. And now we're finding out that the antibody tests may be as accurate as only 50%. Well, that's like flipping a coin. So much for the antibody test. What's the second test? That's called the diagnostic test. And that test tells you if you currently have COVID in your body right now. Well, not quite right now, though. Let's say you go into your local doctor and he gives you the test to find out if you have it now, the diagnostic test. And a day or two later, he gives you the results. And it comes back negative. Well, you might celebrate and say, great, I don't have it. However, if you were exposed to it in the last few days, maybe 2 or 3 or 4 days before the test, you still may have had it and you might have a false negative. That means it says you're negative, but you might be having a very embryonic little bit of COVID in you that the test doesn't pick up. Because even the best tests available right now for diagnostic purposes are only accurate to 95% or so. So, testing is important and you should get it. And if you are in an area where you're going to work, depends on knowing if other people around you are sick or if you are, because most people, almost half, are showing no symptoms and they actually have the infection. So it's important to get tested as often as you can, especially if you're going out for work. I know this summer I'm going away on vacation and I want to be with my family. We're all going to get tested and we're going to get tested and immediately get into our cars and go to our vacation so that we don't infect each other. If you found this interesting, please consider subscribing to this YouTube channel and consider reading my new book, Murder, Inc. You can find that book anywhere you get your books, whether it's Amazon, Barnes & Noble, or online. You can even find it at murderincbyjerry.com, murderincbyjerry.com. And I'm pleased to announce my new podcast, The Warnings Doctor, is available now wherever you get your podcasts, with new episodes dropping every week. And remember, my friends, please remember, the more informed you are, the safer you'll be.